Functions of the larynx. 1. Performs respiratory and vocal functions. 2. Acts as a passageway for air between the pharynx and trachea. 3. Houses the vocal cords, which are essential for speech production. Anatomical location. 1. Located in the anterior neck. 2. Upper border, C4-C5 vertebrae. 3. Lower border, C6 vertebra. 4. Connected to the hyoid bone at the top and continues into the trachea at the bottom. 5. Front, covered by neck muscles, omohyoid, thyrohyoid, sternohyoid, sternothyroid. 6. Sides, covered by the thyroid gland lobes. 7. Behind, adjacent to the laryngopharynx. Divisions of the larynx. 1. Laryngeal vestibule, above the vocal cords. Between the laryngeal entrance and vestibular folds, false vocal cords. Contains the rima vestibuli, space between vestibular folds. Front wall, epiglottis. Back wall, arytenoid cartilages. 2. Interventricular section, middle portion. Contains vestibular folds, plica vestibularis, at the top. Vocal folds, plica vocalis, at the bottom. The laryngeal ventricle is a recess between these folds. 3. Subglottic cavity, below the vocal cords. Includes the rima glottidis, space between the right and left vocal folds. Width, 5 mm at rest. Wider during speech. Front part, intermembranous. Back part, intercartilaginous, between arytenoid cartilages. Extends from the vocal folds to the trachea. Cartilages of the larynx. 1. Unpaired cartilages, thyroid cartilage, largest, forms Adam's apple. Cricoid cartilage, ring-shaped. Epiglottis, leaf-shaped, flexible. 2. Paired cartilages, arytenoid cartilage, pyramid-shaped, important for vocal cord movement. Corniculate cartilage, on top of arytenoids. Cuneiform cartilage, within aryepiglottic folds. Tridacea cartilage, inconstant, not always present. Joints and ligaments. 1. Joints. Cricothyroid joint, between thyroid and cricoid cartilage. Cricoarytenoid joint, between arytenoid and cricoid cartilage. 2. Ligaments. Thyrohyoid membrane, suspends the larynx from the hyoid bone. Hyoepiglottic ligament, anchors epiglottis to hyoid bone. Median cricothyroid ligament, connects cricoid and thyroid cartilages. Cricotracheal ligament, connects cricoid cartilage to trachea. Muscles of the larynx. 1. Tensor muscles, tighten vocal cords. Cricothyroid muscle, stretches vocal cords. Vocalis muscle, adjusts vocal cord tension. 2. Dilators of rima glottidis, open vocal cords. Posterior cricoarytenoid muscle. 3. Constrictors of rima glottidis, close vocal cords. Lateral cricoarytenoid muscle. Thyroarytenoid muscle. Transverse arytenoid muscle. Oblique arytenoid muscle. 4. Aryepiglottic muscle, closes the laryngeal inlet. Histology of the larynx. 1. Layers. 1. Mucosa, contains glands. 2. Fibrocartilaginous layer, provides structure. 3. Adventitia, outer connective tissue. 2. Submucosa, contains fibroelastic membranes, quadrangular membrane, supports the vestibular folds. Elastic cone, supports the vocal folds. 3. Cartilage types. Elastic cartilage, epiglottis, corniculate, cuneiform, vocal processes of arytenoid. Hyaline cartilage, thyroid, cricoid, arytenoid. Phonation, voice production. 1. Sound is produced by vibrations of the vocal cords due to exhaled air. 2. Pitch and strength depend on speed of airflow. Tension of vocal cords, regulated by muscles. 3. Speech is formed by lips, tongue, palate. 4. Laryngeal cavity and sinuses act as resonators.